Thank you, Tom. Uh, and excellent presentation, Dr. Cohen. It just laid the foundation for me to follow. So thank you, audience, for again listening in and viewing on our Talk with the Doctor series. This evening, I'm going to talk to you about new treatments and clinical trials. Now, these new treatment and clinical trials use genetic information to attack cancers. So, and Dr. Cohen mentioned that there were some new treatments, and these new treatments came out about 2 months ago, back in May. And these new treatments are these new options that prostate cancer, metastatic castration-resistant prostate cancer patients can use. Now, these new treatments to kill cancers that have damaged DNA. And what's interesting, and I want to focus on, is that these are not hormonal therapy. They're not chemotherapy. These treatments are DNA repair inhibitors. These treatments prevent the cancer from repairing the broken, damaged DNA. So it was excellent because Dr. Cohen sprinkled his presentation with these key terms that I just wanted to highlight for you again. And so we have this clinical trial glossary that we like to go through before we give a presentation. So in this case, the key concept here is DNA damage. Now, whether or not you can get damage from the environment, environmental factors, from even normal cell activities in the body can cause DNA damage. In addition, you may have heard of a friend or relative who lost their hair due to chemotherapy or radiation. So those type of factors can cause DNA damage. Now, Dr. Cohen mentioned and gave a nice overview of germline and somatic. So I wanted to drive this point home again, is because these are the terms that you're going to hear. So when you're thinking germline, think about something that's inherited, something that you get from your family. Now, when you think of somatic mutations, you think about these mutations occurring at the tumor or at the cancer site. Now, obviously, you're going to hear terms that are going to be passed around like homologous recombination repair genes, the HRR or HER genes. And these genes play a role in repairing DNA strands. Now, majority of times there'll be about 15 that they regularly talk about, but the most common that you'll hear would be BRCA1, BRCA2. And just to clarify, these two genes were really originally identified in breast cancer. So that's why BR, breast, CA, cancer. So breast cancer gene 1, breast cancer gene 2. And then the last term that I'd like to use is a very large word, poly ADP ribose polymerase. But for short, it's PARP. And you'll hear that term because that gene gives rise to a protein, a family of proteins that not only play a role in DNA repair, but they keep the DNA stable. And if there's a problem with the DNA, you can't continue to repair it, it can play a role in giving the instructions for the cell to die. So, next. So DNA repair inhibitors. These are a new class of prostate cancer therapies. So this PARP inhibitor, this protein that interferes with the ability of the cancer cell to repair. So case in point, say prostate cancer. Prostate cancer cells grow out of control. This growth creates damage in the cell. And if the cancer cell cannot repair this damage, it'll stop growing. So PARP is needed to repair the damage. And if the cancer can't be repaired, or if PARP is there, the cancer will survive. The tumor will grow. So what do? We block PARP. Now we're just going to talk about 4, but there are more than 4 PARP inhibitor therapies out there. But Lynparza, Rubraca, Talzenna, and Zejula are PARP inhibitors. Now they work in 2 ways. One, they stop the ability of PARP. Remember what I said before, that PARP plays a role in repairing the DNA that's damaged. But also, it also plays a role in interfering with the ability or influencing the cell to undergo what we call programmed cell death. That just means that the cells are given the instruction to die. So our take-home message is, if you can interfere with PARP's ability to repair the DNA damage, then the cells, cancer cells, will begin to die. Next slide. So this is just our cartoon to show, to kind of give you a visual on how the PARP inhibitor works. So as I said earlier, normal physiology or just the day-to-day activities of your cells can cause damage. Chemotherapy, radiation as a treatment, and if you're exposed to it, that causes damage. And then also there are environmental factors like UV, radiation, and other chemicals that you can be exposed to. All of these can play a role in damaging your DNA. But what happens? If you have PARP floating around, it finds the DNA damage and destroys it. But then if you have a PARP inhibitor, that PARP inhibitor blocks the ability of the DNA to be repaired. And what you're left with is damaged DNA. And that damaged DNA will give a signal to the cell if it's too much. It'll give a signal to the cell to it's time to die. So Dr. Cohen mentioned, and we're really excited about these new therapies for metastatic castration-resistant prostate cancer. One, Rubraca. This is a drug that was sponsored by Clovis. And 2 months ago, yesterday, FDA gave approval. And this indication is for men with metastatic castration-resistant prostate cancer with genetic mutations. Now, before you can be a candidate for this drug, you still no longer respond to medical or surgical decreases in your testosterone. And so they're going to look and see if you have a history of taking Zytiga or Xtandi, and also whether or not you received chemotherapies. But the overall genes that they're going to look for, they want to see if you have these gene mutations, are the BRCA1 and BRCA2 mutations. Now, you heard the word earlier, hereditary. Did you get these genes from your parents, or somatic? In this case, the damage or the mutation occurred inside the tumor. So one, it's easy to get access to, blood, saliva. The other one is there's going to be a requirement for a biopsy. Now, the clinical trial that Clovis sponsored, this Trident-2 trial demonstrated 44% tumor shrinkage. Now, the next trial, the Lynparza trial, and this was sponsored by Pfizer and AstraZeneca, 4 days later, so that's why I said that we're really excited about it. In less than a week, there are 2 new therapies that have come out for men with metastatic castration-resistant prostate cancer with a genetic mutation. Again, just like you saw earlier, they're looking for, did you have chemotherapy or advanced hormonal treatments? The mutations that they're looking for are larger than just the BRCA1, BRCA2. They're looking at tumor mutations at least in one of the 15 that are involved in DNA repair. And as I said before, BRCA1 and BRCA2 are a few examples. And again, hereditary, meaning was it passed on from your family, or is it found in the tumor? Now, what's interesting about the PROfound clinical trial, they demonstrated 33% shrinkage compared to enzalutamide and abiraterone, and the death rate was decreased by 31%. So Now everybody's excited about this. So now we have new therapies, but they're just the beginning. There are clinical trials out there that are hosting a lot of these new PARP inhibitors. So if you've been to clinicaltrials.com, it may be complicated, but that's why we developed the FIN Find Your Trial tool, the FIGHT tool. So in this case, if you identify what area or what your diagnosis is, in this case, we're focusing on metastatic castration-resistant patients. And what we'll do here is, I summarized it, but you can go to our tool and look at a wide variety of clinical trials. But these we wanted to highlight. These are 5 different trials that exist right now that are actively enrolling patients. And these patients are, again, they fall in the category of metastatic castration-resistant prostate cancer. And they're combinations of therapies, and they're not standalone. So whether or not you're interested in Lynparza, Zejula, Rapirib, we have that information on the FIGHT tool. So if you're interested, if you have a loved one, if you're a caregiver, take a look at our FIGHT tool and see what and review it. Now, this is what's so exciting about this. And some folks that may understand hockey, I use the hockey analogy about slapping the puck down the ice just a couple of more feet. These new treatments continue to increase the life expectancy of men with metastatic castration-resistant prostate cancer. Rubraca, Lynparza, these are new treatments for prostate cancer, metastatic prostate cancer. And I want to highlight this, and this is what's very important. This is a new class of drug that expands the current standard of care for men with metastatic castration-resistant prostate cancer. This new class of drugs, PARP inhibitors, are extremely promising, especially as mentioned by Dr. Cohen. You get these advanced therapies and you find out the cancer is resistant to the advanced therapies. What do you have next? Now you have another class of drugs that can help extend your life. And this is why it's so, so important that every man get their genetic information, and especially Black men who are at higher incidence of death. And I say Black men because there was a recent publication last Friday that did a genomic profiling, but just say that what they did was they took information from the African-American men from African ancestry compared to men from European ancestry. And what was extremely interesting was this. They were able to find new gene mutations that were associated in tumors of African-American men. And some of the other things that they found, there were a gene that was associated that mapped closely to your Gleason score. And what was also interesting was a gene called MYC or MYC that was associated with African-American men and metastatic disease. So the point that I'm saying right here is, it is very important for us to know, to get our genetic information, because in this era of personalized medicine, these findings can be beneficial to Black men also. Last slide. So again, thank you for listening in and viewing in this evening. And if you want some more information, please go to our fintrials.com. And if you have gone there and you want to talk or email somebody or communicate with somebody, my email address is kcrawford@prostatehealth.org. So go learn about these trials. Last time. So Finn's motto, knowledge is the best defense against prostate cancer. So thank you for joining us this evening.